live.
Hi everyone, it's Danielle. We're back for part 2. So this is going to be Clear and Brilliant Permea. This handpiece is great for someone who has pigment in their skin, melasma, sun damage, just any kind of irregularities. Also wants to shrink their pores, smoothen fine lines, and even that out. So we're going to start right up top here. We incorporate this treatment into a lot of our different regimens, whether it is to depigment the skin or it is anti-aging or an acne protocol. Pigment is a big problem in cosmetic dermatology, and it can be the result of so many different factors. So when it comes to things like acne, you want to control the active acne, but also eliminate the risk of other side effects of it. Sometimes you get an acneic lesion, and that inflammatory process causes a dark spot, whether it's red or brown. And this is a laser treatment that actually will help to reduce the appearance of that pigmentary change and also smoothen out the skin. So we incorporate it for that. We use this monthly for anti-aging, and it's a great treatment alone or in combination with others for as deep a pigment as melasma.
Is it safe for all skin types?
This one is safe for all skin types. The original handpiece is not. So you do want to make sure that if you're having the treatment done, you're using the correct handpiece. Other than that, it's a pretty comfortable treatment. It feels like a scratchy cat tongue. It gets warm. You do many passes over the treatment area, and you do build up a little bit of heat and redness. Your downtime is not that bad. I would say they consider this like a lunchtime laser. Not very uncomfortable. You leave just a little bit pink. It'll subside. Of course, we use a lot of really good aftercare and some face masks in office to eliminate the redness and, increase the comfort level. But downtime is just about 3 or 4 days of redness, and you get a sandy texture on the skin. That sandy texture is our indicator that you have affected a portion of those cells that are going to be shed off and turned over, and that underneath that little scabby sandy area is going to be a fresh healthy cell. And so that's what we want to bring forward. That's what we want to show. So these treatments are going to be very gentle exfoliators.
What are you specifically targeting for him with this?
So for him, we want to just smoothen some of the lines. Go ahead and turn your head all the way to the side. Perfect. Mm-hmm. We want to smoothen the lines. Everyone has some sort of textural changes in their skin as they age. There's fine lines right here that we get as we smile, which is a great thing. But, you could work over this and pair treatments such as Clear and Brilliant with things like Botox. Botox will soften this and prevent it, but also coming in and creating healthy skin that irons, or using treatments that iron out these lines, is a really great combination. So for him, it's hard to see right now. He's developing some redness from the lidocaine, and of course we've already treated, but there's little tiny pigment changes in the area, and so this is not only going to keep his skin really nice and smooth, it'll further eliminate lines, shrink his pores, and bring his skin to as even a skin tone as possible. So by using the laser treatments in office and combining it with his home care to brighten and fight the aging process, he'll have a really great long-lasting result. You can see here he's got a little bit of browns in the area. It's not too dramatic, but we can really use this to even everything out.
Does this make you photosensitive?
It will not increase photosensitivity, but you definitely want to be cautious with the sun. Every patient who comes into this office leaves knowing the importance of sunscreen. Anything that you do to the skin, you want to protect it. So it's not like some lasers or some medications that they will increase your skin sensitivity to the sun. However, you do want to be cautious. The sun can always cause pigment changes. It's your skin's natural response to the heat of the sun. And after a treatment like this, where you've already put heat and you've already stimulated the skin, you want to allow it to rest, heal, and nourish and replenish itself, as opposed to potentially causing kind of more stress on itself. So you want to allow it to just heal.
Does this work for melasma?
Yes. It's a great treatment for melasma, and it's one that we have every melasma patient doing.
All right, those are all the questions.
Awesome. So I'm going to finish up here. You can see his forehead has developed some redness, and now his cheek is starting to blend together in a nice pinkish red color. We like that. That's a good sign of the treatment registering in the skin. And so once he's all done, we'll place a nice cold mask on him. It'll bring down the redness. It'll cut down his healing time, and he'll feel a lot better after we're all done. He's not going to feel so warm. So thanks for tuning in. That was Clear and Brilliant, the Permea handpiece. If you have any questions, let us know. Thanks, everyone. All right, let's keep going.